Adult spinal deformity can consist of any issue with alignment in the spine that impacts a patient's balance, and that can be in multiple planes, meaning scoliosis, which is a deformity in what we call the coronal plane, meaning looking at somebody from front to back, or kyphosis, which is a deformity in the sagittal plane, meaning looking at somebody from the side. In adults in particular, we can see something called flat back syndrome in the lumbar spine, where rather than having a kyphotic posture or hunched forward posture, a flat back means you don't have enough lordosis or backwards curvature in the spine to match the angle of your pelvis in order to stand up straight. Any one of these malalignments can cause an improper balance, which can impact your everyday life. Balance in particular is probably the most important thing, right? We call it a cone of economy, where we want our head to fall within a certain area over our pelvis within a 360-degree plane. So any one of these deformities, whether scoliosis, kyphosis, flat back, or even too much lordosis causing you to lean backwards, any one of these can cause your head to fall out of this cone of economy, causing you to lean forward, lean to the side, lean back, and that can have a significant impact on your quality of life. So when we talk about deformity correction, we're talking about restoring balance, right? People always want to know, are you going to make my spine perfectly straight? And the answer is no, right? Perfection is not the goal. The goal is to have a balanced spine, meaning your head falls over your pelvis within a certain number of degrees in all planes, in a 360-degree plane, so you can function in your everyday life. When we talk about scoliosis in particular, scoliosis is commonly thought of as a disease of kids and adolescents, either at a school nurse visit or a pediatrician visit. And I think there's a common misconception that for those kids who don't need surgery for scoliosis as a kid or teenager, that throughout the rest of their life that they won't need anything done for it. And that's true in the sense that after your spine reaches skeletal maturity around the age of 18, give or take, most scoliotic curves tend to stop progressing. There are obviously some instances where they can progress, particularly in neuromuscular disorders or syndromic disorders, but in what we call idiopathic scoliosis, where there's really no underlying reason for the scoliosis, these curves do tend to stop progressing once you reach skeletal maturity. But I think where the common misconception lies is that they won't need anything evaluated or done in the future for this. And unfortunately, in the adult spine world, especially when we reach ages 50, 60, 70, and we have other degenerative changes building up in the spine, whether that's degenerative disc disease or arthritis in the spine, we can start to see these curves progress more, which can lead to symptoms down the road. For people with adolescent scoliosis who may or may not have needed treatment as a teenager, I do recommend long-term follow-up, not in the sense that you need to be seen every year, but it might make sense to have a scoliosis x-ray, which is a long x-ray evaluating your whole spine in one picture every 5 to 10 years. And then if you were to start developing symptoms, right, to seek out evaluation from a neurosurgeon for evaluation of your scoliosis and to discuss potential treatment options. For patients who get diagnosed as an adult with scoliosis, whether they were never diagnosed as a teenager or it's something that developed over time with degenerative disease and they are developing symptoms such as pain or change in posture, their workup will include x-rays, oftentimes MRIs and CAT scans. And depending on their symptoms, they may be candidates for what we call conservative treatment, which is often the best place to start, which can include physical therapy and particular types of physical therapy, one of which is something called trough therapy. This therapy will often include breathing exercises, focusing on your posture, your spinal alignment, as well as really focusing on functional core strengthening. And when I say functional core strengthening, I don't mean doing sit-ups and getting a six-pack. I mean doing exercises that help engage your entire core to focus on balancing and providing somewhat of an internal brace for your spine. As an adult, you have, instead of a side-leaning posture and scoliosis, if you notice yourself leaning forward, it may be a result of a different type of deformity, which can be flat back syndrome or kyphosis in your cervical spine or your neck, right? You might find your head leaning forward, or your upper back. You might notice a hunch, or you might just not be able to stand up straight in your lumbar spine at your low back. Workup will be similar in terms of scoliosis x-rays, looking at your whole spine in one picture, oftentimes including MRIs and CAT scans. And then depending on your symptoms, we talk about different treatment options. Again, we tend to start with conservative options, targeting physical therapy, posture training, functional core strengthening.